John, thanks very much. Now, whenever I talk to a new group of people, I do always say, I have a stutter. I will get stuck on words, but just bear with me when that happens. Now, at the end of this presentation, I think what I really want to do is I want to actually convince everyone here that that work on time use is crucial. It is important. We all know about the concept, but the issue is whether we're really going to buy into it in our program and policy work. So, as John has said, this was a joint project, and it was what's called a mixed studies systematic review. Now, for our project, we had a team of people both here and in El Sierra, and the crucial thing is we had an advisory team that was drawn on people who do work on time use, who do work on gender, and who do work on these kinds of systematic reviews. Now, the study itself, the crucial thing, what was the question? So we were looking at this broad question: what are the intended and unintended consequences of agricultural practices, that's common forms of agriculture, and of agricultural interventions, so programs and policies. And the key thing for us was to actually look at that through time use. And that's because we know that the evidence is really good, because we know that agricultural practices and interventions affect time, because they affect the way that that people use time. But time is also a really important input into nutritional outcomes. And that's for a range of reasons. One, because, you know, people take time to provide food, to prepare food, and it takes time to actually feed children. So it's a key pathway. We were looking at studies on that pathway. So we were trying to look at any evidence, either that linked agriculture to time, or that linked time to nutrition. And for us, that was important because we really hoped that it could do something that, you know, has been a real problem in this area, which was to actually draw a big range of evidence. One of the difficulties is there's quite a limited range of evidence that links agriculture and nutritional outcomes, and we wanted to sort of find a way to actually widen that. So, our study, we searched in the main databases, we looked in the main grey literature, and we found almost 6,000 pieces on this area. We screened them, and we came down to 89 good quality studies which dealt with this whole pathway, either agriculture to nutrition or time use to nutritional outcomes. And you can get a picture for those 89. You can see that actually most of them looked at the link between agriculture and time, and a couple of others looked at the link between time and went all the way through to nutrition. 22 did the whole pathway, which was fantastic. Most of those were quantitative, but we also included qualitative and mixed method studies. The geographic distribution, okay, it's very clear. It was dominated by work from Asia, and particularly from India itself. Aside from that, there were a range of studies from sub-Saharan Africa. There are some important gaps that you can begin to hear in the quality of the evidence. Let's look at what the evidence said. What did this work say? Well, crucially, we had 47 studies, and they looked at agricultural practices, so common forms in which agriculture is organised. There were 3 different types. We had the time allocation studies. We had studies looking at the gendered division of labour. We had other sorts of studies there. What they all said, I think everyone in this room will actually be very well aware of, is that women are important in agriculture. Women spend a large amount of time in agricultural activities. We can understand better, though, what the link is if we look at agricultural intervention, so programs and projects. And here we found 5 studies that looked at different kinds of intervention, and actually then told us what happened as a result. How did time actually change? I'm going to pick out a couple of them. In the middle is a project that was promoting irrigated vegetable production in Lesotho. And here it's very clear, as a result of that project, women's time in farming rose. So women spent more time farming. They spent less time in domestic work, and they spent less time on leisure. If I look at the final row of this table, just a different example, there was an aquaculture project in Bangladesh, and that had the impact. It increased women's time spent on waged employment in agriculture. It increased other kinds of non-agricultural work. It didn't seem to affect their domestic work. They were still doing the same amount of hours, and we don't know what happened to their the leisure time, because that wasn't reported in the study. So this gives you a picture, firstly, of the fact that women play a large role in agriculture, and that is reflected in the way that that women use their time. Women are important in the uptake and the response to agricultural interventions. And I think this is the crucial point. All the evidence is that agricultural interventions increase women, men's and children's time burden. So very clear evidence there. The second bundle of studies. Now, here we have 37 studies. And what these looked at were the link either between time use and food and nutrition, or the whole pathway, all the way from agriculture through. These were complicated. These showed that several things could happen. So if women's time burdens rose, it could be that there were very clear negative impacts on food and nutrition outcomes because of these rising time burdens. But it was also true that in other studies, those rising time burdens for women were mitigated because there were other people in the household who could take on particular chores. And that was particularly important for when there were other women or when there were children in the household. So non-maternal caregivers can sometimes affect the impact of those rising time burdens in a positive way. And it was also true, a third group of studies showed something else that was really important, and that this was where those rising time burdens meant that households had higher income. And in those cases, the higher income was being used to purchase food. And that meant that household nutritional outcomes, particularly in the form of calories, sometimes got better. So the impact of rising time burdens wasn't clear-cut. You'll get a better view of this when we look at a particular group of studies. So I'm sorry for the very small text here, but you'll see this in our final report. So here we have 4 studies, and they are of agricultural interventions. On the left-hand side of the screen, you can see what happened to time as a result of the intervention. On the right-hand side of the screen, you can see what happened to different aspects of food and nutrition. Again, I want to pick out a couple to give you a flavour of this. So if we look at the first row, this was a study that reported on a cash crop intervention in Nepal. What did it find? Well, as a result of the intervention, in households that had one preschooler, women and men spent more time farming. The outcome of that was that in those households, less time was spent on child feeding and child care. But for other households, there was no impact. Things stayed the same. The second project in this table was a tree crop project in Sierra Leone, and here the project meant that people, both men and women, spent more time working in farming. The result of that, well, we look at what happened in terms of household calories. They stayed the same, but when we look at anthropometric indicators for child nutrition, those worsen, particularly in poorer households. So calories are the same, but anthropometric indicators worsen. The third project I wanted to pick up from this table, there's the hybrid maize project in Zambia. So as a result of the project, women and men spent more time working, very clear result. The impact of that, well, household calories and nutrient intake improved, sounds like a good thing, but at the same time, there was seasonal negative impact. So there were various times in the year that both children and adults seemed to have worse outcomes. They seemed to have worse nutritional outcomes. So if we look at this body of literature, what does it find? It finds that an increase in time commitment has a complex impact. And that depends on the way that those time burdens, the things people are doing, it depends on the way that those are managed within the household. What does this mean for us? We're going to come on to talk about policy, but it means policy has to be varied, and policy has to be innovative as a result. But I just want to remind you what the differentiating factors were in this. So we found seasonality, something we often don't think about, but that was crucial in terms of understanding when there might be particularly difficult times for nutritional outcomes, times when also the work burden was very high. Household income did affect outcomes. Richer households were much better able to actually deal with rising work burdens. Household composition was important, in terms of the other members there. And importantly, for the final bullet point, is it really mattered what it is we were worried about. If we were interested in total household calories, there were times when we might be quite content with project outcomes. But if we were interested in the outcomes for particular people, or we were interested in nutrient intake, sometimes the indicators moved in different directions. So it matters what we're concerned about. So we've told a complex picture. The issue is, how do we pull it together for people who are interested in policy and in program design? We try to do that in this slide here. And what we wanted to do is to say what matters is the way that time burdens are managed. And that's the issue that really is the focus for policy. Because if we can think about the different ways that that time burdens are managed, it helps us devise policy and programs that work in a better way. So we've grouped these different management strategies into 4 different groups, and we've tried to show, cross-cutting all of them, that of course there are these differentiating factors. So I'm going to go to the first line, and this is the line that's the one that we most often recognise, in the policy world, in the programme world. And this is where it's very clear that increased time burdens are managed by women reducing the time they spend for child feeding and for food preparation generally. So we're very clear evidence of that. Of course, it's crucial in a program, in a project, that we have indicators to actually assess whether that's what's taking place. But the issue is, what's our response? And for us, we thought there are several key areas for policy and program response. And the first is that new technologies and services can be introduced to reduce that time burden. Where agricultural interventions are promoting agricultural wage employment, there could be incentives to provide workers with meals in the workplace. And finally, it's important that our agricultural interventions join up with health interventions to actually deal with that potential worsening of outcomes for vulnerable household members. So that's perhaps the obvious set of findings, but what about the other ways that time burden is managed that are less recognised? Well, the next group of studies showed very clear evidence that one way increasing time burden is managed is that women just work longer hours. So they continue to do the child feeding, they continue to do the food provisioning and preparation, and they just have less leisure time or less sleep. And of course, in a case like this, your household calorie consumption might look good, it might be unchanged, your child nutritional indicators still might look good, but what you might miss is the impact on the woman herself. And for us then, a sort of key issue is that we have a focus not just on households in total, or not just on children in households, but that policy and programs are sensitive to the outcomes for women, men, and children. Again, there is a role for new technologies and services to help deal with this kind of work burden. The third way we found people managed increasing time burdens was by devolving tasks to other women and children in the household. And this again is important because your indicators of household calorie consumption might be unchanged or improved. Your child nutritional indicators might look great, but what you miss is the impact on those people who are now doing extra work. And that can be a physical impact, greater energy expenditure, or an economic one, you're drawing women from their other activities, or an educational one, so children are getting drawn out of education to take on tasks that they wouldn't have done previously. So again, what's the policy response? It is about the provision of technology and services to help deal with that time burden. It's about joining up with health interventions. But crucially, and this might be quite unexpected, we thought policy should focus more on smaller households. And that's because this issue of devolution is really hard for smaller households who don't have other household members who can easily pick up tasks. Finally, and perhaps this is the most invisible of the policy links, but it was very clear that in certain studies, increased time burdens were dealt with by a shift to purchased food. And so what you'd see is that people would actually start to purchase food that in the past they would have grown at home, or they would have prepared at home. And so again, you might miss some of this in sort of standard indicators. Total calories in the household might improve. Children's nutritional outcomes in terms of stunting and weight and wasting might improve. But the concern is this, that this shift towards purchased food can also lead to a shift in diets that are nutrient poor. So this is the most invisible concern, perhaps, in this body of work. What are the policy responses? Well, to increase the accessibility and affordability of healthy food in the local environment, but crucially as well, to actually to engage in interventions that change people's purchasing patterns towards healthier food. Now, as well as a series of policy and programme implications, I wanted to end with some implications for the research base, for evidence generally. So we were happy. We found 89 studies that looked at this issue. It's important to pick out, we only found 9 nutritional intervention studies. And so there's clearly a need for more primary data. But that data has to look at issues of the quality of time use data. We assess the quality of all of our studies in a range of ways. And a problem that, was that the time use data often was not collected well. So that's an issue. It would be good to have data that helped us differentiate households, that had better indicators around employment and socioeconomic status. It would be even better if we have a wider range of food and nutrition indicators that pick up the outcomes for different members of the household in particular. And importantly, that we have data that brings back men into the picture. I mean, you'll be surprised to hear that very few of the studies that we looked at men's time use. So when you look at the evidence, we have very limited evidence on the impact of men's time use. I should end with some limitations of the review. The first thing is, the quality of this review is only as good as the studies which are in it. And it was also true that we were not able to conduct an overall statistical and analysis of the impact of agricultural interventions. There was only one study which would have let us do that. Overall, for a review like this to have even more power in the future, we do need to have more primary evidence. And this has to be in areas that we thought were critical gaps. Now, the first one I've already said, which is information on men's time use, but also information on nutritional change in rural areas. How are diets changing? And we found that actually there were a very limited number of studies, that they tended to be on urban areas. And finally, most of the work that we looked at ended at time use, and it didn't look at what the implications were of different energy intensities. How much time did people spend in agricultural activities? But what was the sort of physical impact of that in terms of calorie expenditure? And that will be crucial if we want to fully understand the impact of agricultural practices and interventions on nutrition. So thanks very much. Thank you.